नमस्ते, मेरा नाम प्रिया मजुमदार है और मेरा बेटा का नाम अर्नब मजुमदार है। हम लोग असम से आए हैं, असम गवर्नमेंट के थ्रू से आए हैं। और ये मेरा बच्चा जेएमसी गुवाहाटी जो जेएमसी है उसमें पहले ट्रीटमेंट किए थे, लेकिन उसका कोई फ़ायदा नहीं हुआ। हम लोग ऐसे ही मतलब मेरा बच्चा मेरे ऊपर ही डिपेंडेंट था। वो खुद से चल नहीं पाता था, कुछ मतलब ऐसे ही हाथ से चलता था। अभी उसके बाद हम लोग आसाम से तो आए हैं यहाँ, ये बेंगलोर नारायण हेल्थ सिटी हेल्थ केयर पे। यहाँ पर आने के बाद सर्जरी किया, सर्जरी के बाद वो अभी बच्चा चल पाता है। इससे बड़ी खुशी मुझे 6 साल के बाद अभी मुझे मिली है। जो मेरा बच्चा अभी मेरी गोदी में नहीं बल्कि मेरे बिना वो चल सकता है, वो खुद स्कूल भी जा सकता है। और ये फ़िलहाल वो खुद का जो खुद मतलब खुद का काम जो होता है ना, वो सब कुछ नहीं खुद ब खुद ही कर पाता है। नहीं तो मुझे लेके जाना होता था कहीं पर भी जाने से, तो वो नहीं हो अभी लगता है। हम लोग आए हैं तो यहाँ पर आके बहुत 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 ज़्यादा ही बेहतर मिला है। बाकी डॉक्टर से भी इनका मतलब अभी तो आप देख ही पाओगे, जो मेरा बेबी है वो कितना अच्छे से चल पाता है। लेकिन पहले तो चल भी नहीं पाता था और हर किसी से वही बात सुनने के लिए मिलता है, तुम्हारा बेटा चलता नहीं है, कैसे लाइफ में चल उसका पार होगा, यही सब बात है। लेकिन अभी हम लोग को मतलब ये सुनने के लिए नहीं मिलेगा और मेरे बच्चे को भी सुनने के लिए नहीं मिलेगा। अभी फ़िलहाल तो मेरा बच्चा अभी चल पाएगा।
So I am Dr. Vikas Ilur, practicing consultant pediatric orthopedic surgeon at Narayana Health City, Bangalore, NH Orthopedic Department. So today I will be going to share my experience of treating a child suffering from one of the rare congenital disorders affecting the lower limb of the child. So here is a 10-year-old boy who comes from Assam, a remote village from Assam state. So he is a child who has a congenital deformities where it was affected his legs. He was not able to walk on the legs and used to walk on the knees. The condition which he has diagnosed was tibial hemimelia. So it is one of the rare condition affecting the legs in the children or a newborn, where the tibia is absent or deficient at the birth. So this condition is one of the rare condition coming under the classification of limb deficiencies. So this boy had a bilateral, both the sides tibial hemimelia, where one side, that is right side, the complete tibia was absent, that is we call as a Jones type 1. The other side, the left side, he had an absent or a divergent tibia and fibula with defective ankle. So this is comes under type 4 zones classification. So in this kind of scenarios, we considers the child evaluate the child for other genetic disorders, other associated genetic problems or other associated systemic and limb deficiencies. This is most commonly it also affects the knee, hip, spine along with the leg. So once the child presented to us, so we evaluated with the basic investigations, radiological investigations, genetic assessment was done, and we came to a diagnosis along with the associated clinical features. So once the diagnosis was made, the clinical conditions, the severity, the associated genetic issues was diagnosed and treated. So we planned for the surgery of this child. So before going ahead with the surgical plan, so there are the several options of treating the conditions. So we have discussed with the parents about the available options. So most commonly this kind of conditions have joint deficiency also. So we have to consider it along with this leg deficiencies. So once this deficiencies was diagnosed, discussed with the parents, so we went ahead with the surgical planning of amputation and prosthetic fitting of the child. So before going to ahead with the surgery, so we discussed with the various available options based on the child's conditions. So as the child had absent tibia on one side, so we could not reconstruction of the leg, so we went with the prosthesis, amputation and prosthesis. The second left side, there was a tibia tibia, but it was a defective, only a partially tibia was present, the ankle was underdeveloped, there was a duplication of the fingers, and there was absent quadriceps function and knee ligaments. So again on the left side also we decided to do a below knee amputation and with the prosthetic fitting, and on the right side we went ahead with the knee disarticulations. So once the surgery was done, the child recovered within 2 weeks time, the skin was healthy, and then we took a prosthetic measurement. After 6 weeks prostheses were ready for the fitting. So once the prosthesis was ready, this is the child, once that the prosthetic is fitted, so he is able to stand with the artificial limb along with the support. And again this is a walking of the child post prosthetic fitting, that is around 2 months from the surgery. So this is how the child is there, is able to walk, who once never walked on his legs in his whole life, now he is able to walk with a smile on his face, and he is happily ready to go to his hometown Assam and inform to his friends and relatives about the success story of his surgery. Thank you. So once again I want to thank all the persons, our people, staff, hospital management helping the child to get on his limbs, and again thanks to Narayana Health City management and the nursing supporting staff helping me to get the surgery done and bring back the smile on his child face. Thank you.